Hello, my name is Mallory Raymond, and I'm a neurotologist at Mayo Clinic, Florida. A neurotologist is someone who performs surgery on the ear and lateral skull base in order to help patients with conditions that affect hearing. Today, I'd like to talk to you about the treatment of adult age-related hearing loss with the use of cochlear implants. Age-related hearing loss affects a large percentage of the population and not only leads to difficulties with communication, but also has been linked to social isolation, depression, and cognitive decline. Age-related hearing loss occurs because of degradation of the neural contribution to hearing. Early age-related hearing loss that is mild can be treated with hearing aids, which are devices provided to patients by audiologists or hearing specialists that are worn over the ear or in the ear canal and that amplify sound. However, when the hearing loss progresses and leads to a diminished ability to understand words clearly, no matter how loud they are, hearing aids are not a good option. In this case, cochlear implantation is the only treatment for patients who can no longer be helped by hearing aids. A cochlear implant is an electronic device that bypasses damaged portions of the inner ear to transmit sound directly to the hearing nerve. The device has three components: the processor, the receiver, and the electrode. The processor is a device that patients wear over their ear and on the scalp that helps capture sounds from the environment. The processor sends the signal to the receiver, which is implanted under the scalp. The two are held together by magnets, like this. The receiver then sends signal to the electrode, which is coiled within the cochlea, or the snail-shaped inner ear organ, and from there, the electrical signal is sent to the hearing nerve and the brain. In order to determine if you are a candidate to receive a cochlear implant, you will undergo a series of hearing and speech understanding tests with an audiologist. You might also undergo a series of balance tests and a CT scan or an MRI to look closely at the inner ear. If you are deemed a cochlear implant candidate, you will work with your audiologist to choose a device and features of that device that best support your lifestyle. Many patients are under the impression that cochlear implant surgery is dangerous, but over the last several decades, improvements in the technique and technology have made it very safe. Though it's performed under general anesthesia, it's usually done on an outpatient basis. An incision will be made behind the ear. A small portion of the bone from behind the ear canal will be removed in order to provide direct access to the entrance to the cochlea. The receiver will then be slid under the scalp, and the electrode will be inserted and wrapped into the cochlea. The scalp incision is then closed with stitches, and a bandage is placed over the ear for 1 day. The wound is given some time to heal, after which the device is activated or turned on by an audiologist. This can be done anywhere between a couple of days after surgery to a couple of weeks. There are a few risks of surgery, and they include loss of residual hearing, infection, and device failure with time. Complications of surgery are rare, but can include temporary dizziness or altered sense of taste. Hearing improvement after cochlear implantation is often not automatic. The brain takes time and needs practice to adjust to the new sound. If you receive a cochlear implant, you will work closely with an audiologist to program and adjust it to optimize your hearing and understanding. Visits with the audiologist usually occur at regular intervals over the first year after the device is implanted. You'll also be given resources to practice using your device at home. Though the results of cochlear implantation can vary from patient to patient, most patients, 85%, will experience a significant improvement in their hearing and understanding. Many patients will also experience a significant improvement or resolution in their tinnitus or ringing in the ears. If you are suffering from hearing loss or not being helped by hearing aids and you think you might be a cochlear implant candidate, please feel free to connect with us. At Mayo Clinic, Florida, and across the whole enterprise, we have an outstanding team of audiologists, vestibular specialists, and neurotologists who prioritize collaboration and putting the needs of our patients first, and we would love to help. I hope this video was educational, and thank you so much for viewing it.